Good afternoon. I'm Dr. Sandra Martell. I'm the Public Health Administrator for Winnebago County, and today I'm joined by Mayor Tom McNamara from the City of Rockford. I'm going to focus today a little bit on actions to combat the resurgence of COVID-19 and give everyone a little background information. When we talk about our region, Region 1 includes Boone, Carroll, DeKalb, Joe Davies, Lee, Ogle, Stevenson, Whiteside, and Winnebago. The metrics that were put out 2 weeks ago, when they started to look at what would we do if there was a resurgence, and how would we look at the numbers. There has to be a sustained increase in a 7-day rolling average. I know there's going to be a lot of math in this, but basically over a week, do we continue to see an increase in positivity? Do we also see an increase in hospital admissions or a reduction in hospital capacity, where we have less than 20% of our hospital beds available? In combination, those might cause us concern about how do we implement some additional tiered approaches to the resurgence. There's also, if we do a 3 consecutive day averaging greater than or equal to 8%. So when we look at these metrics, we begin to be available on the website, what we report every day. It starts to tell the picture of when do we get concerned that the COVID-19 is resurging in our community. We're in phase 4, but what does that mean when we start to get increased cases? As of today, which is August 2nd, Region 1, which includes all of our counties, has had 5 days of positivity increases. But the good news is our hospital admission rates and availability continue to be stable. However, on Friday, we received notification that Joe Davies County in our region was at a warning level for COVID-19. Their current case rate was 150 new cases per 100,000, and according to the state, the target is 50. But I don't want Winnebago to think they're resting easy. We were at 61 for that same time frame. Their positivity rate was 11.3%, which was over the target of 8%. But our positivity rate was 5.2% as reported on by the state. This increased positivity rate and the increased number of cases were related from travel to and from hot spots or areas where there was increased case activity, such as Iowa and Wisconsin, and larger social gatherings. We look at each other and we figure out how do we move together to best keep our positivity rates low so that we can continue to begin to restore and recover from COVID-19 in our region. So if we continue to decline, it's called a tiered response. I often hear, are we going to go back to phase 3? Well, technically, we're not going to go back to additional social mitigation strategies. For instance, at least would reduce indoor dining capacity, reduce elective procedures in our healthcare systems, limit social gatherings further, decrease room capacity, and decrease organized fitness and gym capacity. We continue to have positivity rates that increase and new cases arise and our hospital capacity gets stressed. We'll be suspending indoor dining, suspending elective procedures, suspending organized recreational activities, limiting to non-essential retail, and limiting personal care. If things continue to further decline, we step into what's called Tier 3, where we go into that strictest kind of restrictions possible. Limiting gatherings and room capacity even further, remote work for non-essential, limiting to outdoor recreation only, and personal care based on outbreak status. So as we look at this, and we were put into a warning status by one of our counties on Friday, we need to be continuing to work together because we want to continue to really expand. And remember, we're all working toward the goals in the fall for some form of in-person learning. And that gets jeopardized each time that positivity rate increases, or each time that we continue to have sustained positive increases in caseload. So again, it's incumbent on all of us to recognize, well, one in our region struggles. We are not out of the zone, so to speak. We need to work together because we really succeed and fail as a region at this time. Part of that tiered response. The goal is to continue with our current activities. Continue to update our travel guidance, recognizing that people do travel at this time of year, but understanding you may be going to areas or spending time in different ways that we want to make sure protects our community from the transmission and spread. Masking. I don't know how many more ways we can say it or how many different ways to wear them, but masks that cover our nose and our mouth. Not chin guards, but real masks. Continue to take it outdoors as much as possible during this beautiful time of the year in our area. Limiting group size. I often hear, well, if I have 3 groups of 50, right, I can have an event that's 150. No, there's an intent and a reason. We're really reducing that capacity and crowd size. And of course, we talk incessantly about hand washing, frequent sanitizing of touch surfaces, and staying home when you're sick. But these are the actions that we have so that we do not need to put more restrictions on our reopening or stepping back in those tiered approaches. We also learned over the weekend about tests conducted from July 12th through July 24th, that including some of our pop-up test locations and our University of Illinois Health Sciences campus, that we're using a laboratory called Raditis, in which there were some issues with reporting of results. This is not the same laboratory that we had issues with earlier in the pandemic on the testing. And so again, we're very disturbed about this. It is unfortunate, it's regrettable, but it's not within our control. And so we as a community need to continue to move forward. Please call the hotline if the state confirms that your laboratory test was compromised. Seek additional counseling regarding repeat testing, because you may be out of the zone at this point. If it's been more than 10 days and you had signs and symptoms of illness, is it necessary to test? If you're in a quarantine period, we'll go through and advise you in the best possible way that we can so that you can return back into your environments as quickly as possible. So either release you from isolation and or quarantine. And I remind employers to work with the health department regarding the use of tests for return to work. We're seeing a lot of individuals being told that they should serial test to return to work, or that they need multiple negative tests to return to work, and that is not advisable under current guidelines. If you have concerns about your workforce environment or individuals returning or that need to be tested, please consult with us and we will provide you the best guidance we can. We don't want to stress an undue burden a testing system, which when there is large capacity concerns and issues, often has issues with reporting. We want to make sure that our residents who need testing, get their accurate results back in a timely fashion so they can take the appropriate action and we can conduct our contact tracing. So that was the information we learned over the weekend. I also get a lot of questions about, you are our partners with the health department. I see given by non-health department personnel about testing, about when you can return to work. I've heard all kinds of stories about, I can't come back until I've had 5 days of rest and I've had a negative test. I want to advise the public that we are the experts in this area, and we will work with employers, we will work with schools, we will work with daycares to make sure that they have the most up-to-date and current guidance so that people who do need to be isolated or quarantined are appropriated and or quarantined for the proposed amount of time that's required, and then are returned appropriately so that no one is disproportionately burdened by inaccurate or incorrect information being given to them. Reminder that you cannot test your way out of quarantine or isolation. So oftentimes I hear, well, I'm just going to go get a test and I'm in quarantine because I came back from a vacation hotspot. You cannot test your way out of the quarantine period. And ill individuals, regardless, are required to isolate for a minimum of 10 days and 24 hours of being absent of a fever without fever-reducing medications. So it's as if that testing can provide you with a kind of get out of isolation or quarantine. And the reason for that is, remember, not every test is 100%. Test results may be delayed. Quarantine or a test at any point in time is a test in time, and we continually have to remind individuals that the testing technology to date has not changed significantly in that. So you can't test your way back out of quarantine. Last week was busy. We also heard that all sports policy was released on August 15th. Sports were classified as high risk based on their contact, such as high contact sports for things like football, wrestling, hockey, competitive cheer. Medium were things like basketball, volleyball, and paintball. Lower were cross-country, crew, gymnastics. And the level of play is determined again by the level of metric in our community. So I come back to, if you want to get back into competitive sports and play, if you want to return to those activities, we're all going to continue to have to work to make sure that we're not having to put tiered mitigation in place. So level 1 is the most restrictive. That is training only. Think about when we first started back up, it was the most restrictive. Level 4 is when we're talking about, it's the least restrictive. That's where we can do tournaments and out-of-state competition and return to our big, regional competitions and things that traveling teams can go to. So within that, there's a lot of variability. But again, within that response, we want to be able to make sure that we're in a tier 3, right? We know that tier 4 is going to take us a while to get there. But we want to be able to do play within our communities, regional athletics, play within our state. We really need to continue to work on those metrics. And the current recovery phase, for low risk levels, they can play at levels 1 through 3. So nobody is at level 4 where we're doing out-of-state tournaments, we're inviting other states in our region to play. It's in-region play. Medium risk are levels 1 and 2. So you start to see a little less ability to kind of intermingle teams, again, because of the exposure. High risk is only allowed to do level 1 now, which is conditioning and training. So I know that's a lot of risk, a lot of levels, a lot of tiers. And unfortunately, I wish we could say we all had the same language, which would make it easier for the public to understand. But the idea being that we really want to be able to be mindful of those activities that, again, have the greatest risk of helping us to spread the virus. We need to then begin to stand back, walk back, make sure that we're putting things in place so that we can enjoy a sports where we can go out and play. Baseball has proven to be kind of a challenge at the major league level, but not at the local level. We were able to have a lot of seasonal play still going on. We had some tournament play within our region, which again allowed for individuals to get out and enjoy the summer weather, get children out to play, get people out to watch their families in appropriate ways. But again, we've got to make sure that we are being mindful of those crowd gathering sizes and those activities that put us at risk for transmitting the virus. So wearing those masks, frequent hand washing and sanitizing, and keeping that group size to a cohorted amount, a small group size that we know who's been exposed then in the event of a potential case of COVID. The governor today announced a new campaign. I'm sure you've all seen it, masking. It only works if you wear it. So here's my mask. It's similar to seat belts, life jackets, helmets. And again, I remind everyone, we are all in for Illinois. We have fought way too hard, and we are all in for 815. We have worked very hard to keep our infection rates low, to be able to reopen our businesses and return to some degree of normalcy during all of this in phase 4. We don't want to have to step back in a tier or become more restricted. Our goal is to continue to remind everyone of the importance of masking. And again, it only works if you wear it. we need to continue to protect our lives and our livelihood in our region. So new numbers for today, 14 cases. Our total cases are now at 3,669. And we do a 7-day rolling average positivity rate, which is calculated based on the numbers we have in hand in this health department about all of our test results, and our positive test is at 3.9%. 96% of our individuals have recovered or been reported as recovered. Unfortunately, though, we have one new death to report, bringing our total deaths to 115. And again, every death is a concern for us. When you look at the number of our residents and community members throughout the United States have died, it's the size of many of our cities and communities. And we would not want to lose any more. We have no new locations of concern to report. So with this, I want to remind everyone again, as we look at our region, as we look at their state, as we look at those numbers, it is in our control. And again, wearing a mask is one way that we can help protect our community. Because again, we don't want to step back. We want to be able to then move forward and continue to be able to expand and look forward to opening of the schools for some in-person learning environments, some in-person, some school sports where, again, important social emotional learning can occur. Next week, we plan to have representatives from our school districts speak about all of the plans that they are making to help bring children back into the educational system for a blended, remote, in-person learning, and how they see the school year shaping up as we approach that. So with that, I'd like to have Mayor Thomas McNamara step up to the mic and for his remarks.
Thank you, Dr. Martell. Again, appreciate your leadership and certainly appreciate most recently all the mobile testing sites, pop-up testing sites, if you will, that is improving the much needed access to testing for everyone in our community. It's kind of hard to believe that we are now coming up and marking the 5th month that we've been doing this together, and I would share some of the sentiments that you stated, probably nicer than I will, regarding I don't know how many different ways we can say some of the same things to you to ensure that all of us are playing our role as one community team. A tremendous thank you to those residents who have done the good work and been vigilant and played that role of wearing the face covering, washing the hands, cleaning the frequently used surfaces, taking events outside, practicing social distancing. A huge thank you to them. A big thank you to the businesses. Since just over the last couple of weeks since businesses joined us, I'm not aware of a business in the city of Rockford that has been fined. They've all been heeding the incredibly strong guidelines to make sure that employees and patrons are wearing them. So just want to say a big thank you to our businesses as well as citizens. Again, I'll just close out my comments on COVID-19 by simply wear your face covering. It protects others when you wear it. It benefits all of us when everyone wears it. Next, I just want to touch on 2 quick topics. One is the census. We are now below the state average for completing the census in our community. We need to increase our numbers. It is incredibly easy to complete your census. You can go to my2020census.gov, and it is incredibly important to everyone who calls Rockford home that you complete the census. 2 huge areas that it has an impact is on our representation in Congress. We know right now that we are bound, the state of Illinois is bound to lose at least 1 congressional district. If we perform poorly on the census, we have the potential to lose a 2nd seat. That would be devastation to our state of Illinois. Second is For every single person who fills out the census, your community, if you live in Rockton or you live in Roscoe, your community receives $1,560 per person, and that is consistent for the next 10 years till we do the census next. And so one person completing the census in your community is the equivalent of $15,600. That's a huge impact on your local area so that we can provide critical core services. And if those who don't complete the census, we still need to provide those services. So I'm urging everyone, take the 6 minutes it takes you to complete the census and wear your face covering. The last item I'll say is we are obviously still challenged in our community with domestic violence. Survivors are still looking for hope at every corner that they turn to, and I would just want to remind folks that we are taking appointments and have been taking appointments for the last 2 weeks at the Rockford Family Peace Center, and you can visit our website at rockfordfamilypeacecenter.org, or you can call them if you are in crisis or need, and you can call them at 779-346-600. That's 779-348-7600. And with that, we'll take questions.
Dr. Luttrell, I have a question for you.